I have seen thyroid testing done wrong time and time again, and it kills me because one of two things happen. You either end up leaving the doctor's office feeling hopeless, like there's something wrong and no one can figure it out, or you end up leaving feeling like it's all in your head and there was nothing wrong in the first place. In this video, I'm going to fully break down thyroid panels for you so you can get tested the right way once and for all. Keep in mind that a good doctor is going to closely correlate your symptoms with your lab tests. Some symptoms of hypothyroidism, which is the most common form of thyroid dysfunction, is thinning hair, thinning of the outer third of the eyebrows, difficulty losing weight, unexplained weight gain, anxiety, constipation, and more. Okay, so let's move on to the testing. So what I see happen time and time again is women will go into their doctor's office and they'll complain about the symptoms that I just mentioned, and their doctor will order a TSH. What this stands for is thyroid stimulating hormone. This is a hormone that's secreted by your pituitary gland that tells your thyroid to make thyroid hormone. Now, if your TSH is sky high and super elevated, that is a giant waving red flag that there's a problem. But here's the dilemma with that. Our bodies don't always wave big red flags at us. Sometimes they're whispering, and we have to really pay attention to notice what's going on. That's where it takes a really good doctor that takes your symptom history, takes your health history seriously, and orders the proper labs. So let's move on to talk about what the rest of the labs should be. So the next set of labs that you want to go along with a TSH are T4, T3, and free T3. Now let's talk about what those values mean. When your thyroid gets that message from your pituitary gland to make the thyroid hormone, what it's going to make is something called T4. T4 is not the usable form, however. It then needs to be converted into T3. So sometimes we can see a problem with this conversion. One area I see this issue frequently with is gut health. A healthy gut is crucial for optimal conversion of T4 to T3. Another area things can go wrong is thyroid hormone binding globulin. This is a compound that will actually bind up your T3, which makes it unusable. Think of it as being wrapped up in a rope. It's bound with the binding globulin, and then it can't be used by the body. So if you have a really, really high thyroid hormone binding globulin count, then your body is not going to have as much free T3, which is the T3 that's running around free and is usable. And then therefore, you're not gonna have enough of that active thyroid hormone to do the job that you need it to do. This is why you need to look at the free forms of the hormone. That means it's free and floating around and ready to be used. Asking for this specific set of labs will help ensure that you see all of the steps that your thyroid needs to go to produce the usable form, which again is that free T3. So if you ask for TSH, T4, T3, and free T3, you'll be capturing all of those labs needed. The final set of thyroid labs that you're going to ask for are thyroid antibodies. This is crucial and very often overlooked. What you're looking for here is to see if your body is launching an autoimmune attack against your thyroid. The most common form of this is HASHIMOTOS thyroiditis. If your antibodies are elevated, you may have an autoimmune thyroid condition. This is important to know because this is going to help inform your treatment plan. For example, if you have Hashimoto's, you should not be eating gluten. I'm going to say that again. Do not eat gluten. This is because of something called molecular mimicry. The gluten molecule looks very similar to the thyroid molecule. And in your body's heightened autoimmune state, when you ingest gluten, it's going to launch an even bigger attack on your thyroid every time. It's a vicious cycle and you don't want it to happen. So if you have Hashimoto's, you definitely need to stop eating gluten. Okay, so there you have it, the full list of super important thyroid labs that you need to get done if you suspect you have a thyroid condition. Now, if you want this all written out for you as a PDF that you can print and take to your doctors with you, make sure you click the link below. That will take you right to the download page. And of course, don't forget to hit the subscribe button and the notification bell so you won't miss any new videos, which by the way, come out every Monday and Wednesday.